In this video, I want to demonstrate and describe palpation of the superficial back muscles, posterior scapula and shoulder girdle and rotator cuff muscles, and corresponding bony landmarks. So we'll start a little bit coming off the scapula and try to relate that to thoracic spine palpation and position. So her scapula, we can kind of envision the outline like this, kind of like a triangle. So superior border, superior angle, medial border, lateral border, inferior angle. One thing that's going to make this a little bit easier to visualize, and hopefully you can see this, is if I come around to her anterior shoulder and give a little bit of lift, you can kind of see that scapula kind of pops out. On different individuals, it's going to be more or less prominent, partly depending on their muscular development and just regional anatomy or morphology. But I do think that helps you to locate at least that inferior angle and some of these landmarks of the scapula. So from the inferior angle, I'm going to utilize these landmarks on the scapula to kind of tell me where I am in the thoracic spine. So what we know is that at the inferior angle, that's roughly going to be at the level of the T7 spinous process. So that's kind of a nice little visualization for me. So T7 is going to be right at that inferior angle. If I come up the medial border to the scapular spine or spine of the scapula, that's going to place me at about T3 spinous process. And then if I continue to go up to that superior border of the scapula, that's going to put me right around T1, T2. So I usually think T1, T3, T7, or superior border, spine of the scapula, inferior angle. That gives me a really nice sense of this regional geography of these bony landmarks and kind of keeps me honest as far as my palpation, so I'm not all over the place. So the other things that I want to palpate are muscles that are in the superficial back that are going to attach to some of these bony landmarks. So if I start with the trapezius muscle, it has broad attachment points. I can palpate on the occiput at the external occipital protuberance, also called the AN, and I can follow down the cervical spinous process. The trapezius muscle is going to emanate from all of those attachments, and again, broad attachment sites, and it's going to travel all the way down to T12, roughly in there. So all the way down, it's going to attach to all those spinous processes, and we can break out the upper trapezius coming in this direction and these fibers, and so we can palpate through that upper trapezius muscle, and it's going to attach to that superior portion of the spine of the scapula. The middle trapezius muscle from these thoracic vertebrae to the medial border, and also the root of the scapula where that spine of the scapula meets the medial border. And then we can envision the lower trapezius fibers running in this direction, roughly this oblique direction, from these thoracic spine vertebrae up to that root or the medial border of the scapula. So that's the upper trapezius, or upper, middle, and lower trapezius, so the trapezius muscle. We can also envision below that trapezius muscle the rhomboid muscles. So the rhomboid minor is going to attach and run in this direction. Rhomboid major is going to be just below it. So rhomboid minor is going to attach to C7, T1 spinous process to that medial angle. So I can kind of palpate through here, the rhomboid minor. And then rhomboid major is going to be T2 to T5 spinous process to the medial border of the scapula. So again, I can palpate through here. And notice I'm palpating oblique to the muscle fibers. So rhomboids roughly in there. Trapezius muscles. We also know in the superficial back, we're going to have levator scapula up top, and we're also going to have latissimus dorsi. So for the levator scapula, I can think about the insertions, the posterior tubercles of these cervical vertebrae, and that levator scapula is going to come down and attach to the superior angle of the scapula. And that's going to be a common point that is sometimes tender on individuals right at that insertion, at that superior angle. So we want to remember that for levator scapula. For latissimus dorsi, we have broad attachments, and I usually think about the complementary nature or the latissimus dorsi coming underneath and almost crossing the trapezius muscle. So the trapezius muscle is going to be like a trapezoid or a rhomboid shape. So it's going to be roughly this shape and these directions of muscle fibers. Latissimus dorsi is going to come up and underneath the axilla. It's gonna attach to the lateral lip of the bicipital groove, but posteriorly it's gonna have these broad attachments. So it's gonna attach to thoracolumbar fascia and all the way, spinous process all the way up to T6. And then it's gonna kind of run in this direction, up and around. So if I wanna palpate for latissimus dorsi, I'm gonna have her try to push back into me and towards her side. So back and in, and I can kind of feel that muscle come on tension. So it's gonna be this broad muscle, but it's gonna be probably easy to palpate through here as it runs through into the axilla. The other muscle group that's gonna be complementary to the latissimus dorsi are gonna be, or primarily is gonna be the teres major. So it's gonna perform similar actions as latissimus dorsi, sometimes called the little lat, which is kind of funny, but I think it helps remember those common functions. So if we again come and find our scapular landmarks, so if I find that inferior angle and this lateral border, I can kind of envision, here's the spine of the scapula. Inferior to that spine is going to be the infraspinous fossa and the infraspinatus, one of our rotator cuff muscles, so I can palpate through that. And then right below that infraspinatus is going to be the teres minor muscle, roughly going in that direction. Infraspinatus, supraspinatus, teres minor are all going to come and taper and insert to that greater tubercle on the humerus, and there's a video on those rotator cuff muscle attachments if you want to review that. And then below that teres minor is going to be teres major. So again, I can kind of follow through here and palpate the posterior part of this axilla, and that teres major is actually going to come under, and it's going to come to the anterior humerus because it's an internal rotator adductor, similar to latissimus dorsi, and it's going to assert to that medial lip of the bicipital groove on the anterior humerus. So if you remember where those muscles are, that's often helpful. The other rotator cuff muscle that is really deep, it's going to be hard to palpate, but we can kind of envision where it is as I'm palpating through the spine of the scapula. If I go superior, I'm going to be in the supraspinous fossa, and deep to that trapezius muscle is going to be the supraspinatus. So if I sink really deep, perhaps I can palpate that muscle, but that's going to be kind of difficult. The other thing I can palpate up in this area is actually her first rib. So if you remember the trajectory of the first rib, it's going to be roughly like this. It's going to sit kind of at this angle. Clavicle is going to come up and across, so that first rib is going to be deep here. And I can either try to palpate that first rib coming, so I have to move the trapezius muscle out of the way. So I'm either going to palpate here, which is hard to do posteriorly, anterior to that upper trap. So I'm actually going to choose to palpate from the posterior side, but I need to move that upper trap muscle out of the way. So if I move that a little bit anterior and sink my fingers in deep, then I can locate the first rib. It's often tender on patients, and it is a little bit deep, but I think you will be able to feel, if you are in the right spot, the bony structure, hard structure, and it's going to be, again, posterior to that upper trapezius, and you're going to be a little bit superior to the superior border of the scapula. So don't fall on the scapula and think you're on the first rib. So it's in between these two landmarks is the best way I can describe it, and you're going to sink deep and almost at this oblique angle to locate that first rib.